I'm Ramaswamy Govindan, a professor of medicine at the Washington University School of Medicine in St. Louis. Our patients often ask this question, you're telling me that I'm cancer-free, what can I do to decrease the chances of this cancer coming back? Again, this is an important question that physicians have to answer accurately without confusing our patients. Um, the the important the context is important. There are times, uh, understandably, everybody wants to be told, or physicians want to tell patients that you're cancer free. So it is important. The longer we go, the better off we are in terms of the chances of recurrence. Um, First and foremost, I tell our patients that most cancers that come back after a period of definitive therapy, for example, an early stage or locally advanced lung cancer, for example, and the most common time for the cancers to come back is often the first year to 2 years after completing therapy. In fact, 60-70% of the cancers that come back do so within the first year or two. And and then if you go longer, the chances diminish, not completely go away, but substantially go down. And after 3 years, the number of patients who get the cancer back are become lower and lower. In some instances, that's more true than in other instances. In my 25 years of practice, I've never seen a small cell lung cancer patient recur after 3 years. And I always tell our patients that. And well, there can always be exception to this rule. Some cancers do so more often. In fact, years ago, we published a paper where we looked at the relapse patterns and relapse incidence in patients with stage 1 non-small cell lung cancer after complete resection. And we looked at close to 1,000 patients. And it turns out that the average time for relapse is about a year and a half, and majority of them had the cancer return within about a couple of years to 2.5 years. And so it's important to keep that in mind. The type of cancer, the stage of cancer, the duration of follow-up. If you had an operation a year ago, 6 months ago, and the CAT scan shows that no evidence of cancer, that's great news. But then you just have to keep this in mind that a year from now, you're going to be better off than today. 2 years from now, even better off than 1 year. So the time matters. So that's about putting that into context. But the question that I've not answered yet was the question that patients often ask, what can I do to decrease the chance of this cancer coming back? Honestly, not a whole lot. And I think these are heavily under the influence of cancer biology. Many cancer cells are dormant. They stay, that means they just, they're laying low, without growing for a long time. And then at the right time, they begin to grow. And there's not a whole lot you can do. I think it's important to keep in mind certain things are good for all of us, not just for cancer patients. Important to be conscious of what we eat. And, there are no magic diets that can either prevent cancer in these situations or decrease the likelihood of this cancer coming back. A well-balanced diet and adequate calories, and then be mindful of what we eat. And I think that's important. There is a myth that sugar feeds cancer. That's taken a lot of context. And I think a well-balanced diet with adequate amounts of protein, fat, and modest amounts of carbohydrates, and something that's balanced, I think is important. And also, it's important to keep in mind that we eat less processed food. And again, this is not related to the cancer recurrence. It's just generally a good thing for us. And you know, it's important to keep that in mind. And physical activity, I think, is quite important. And I think we often forget that there are many other diseases that can hurt us. And many other diseases can kill a patient, not just the cancer alone. So it's important to keep that healthy diet and physical activity, regular exercise. It's even more important for patients with lung cancer who have undergone either radiation or chemotherapy or surgery that diminish the lung capacity to keep them active. And also there is something to be said about not having a stressful life. And nobody can have a stress-free life, but I think minimizing that is important. There have been papers published and written about stress and the effects on the immune system. It is conceivable that high amount of persistent stress can increase the level of a hormone called corticosteroid hormones that can diminish the immune fighting cells, and that could potentially can adversely affect lots of things in our body and perhaps even cancer recurrence, although this has not been firmly shown, shown in any good clinical studies, partly because how do you measure stress? And, those are hard to do. But in general, a life of, life that is well led without stress is good for everybody in general. So that's something important. And then keeping up with these appointments. The surveillance scans are helpful to some extent, and they are probably not as helpful as people all think, but because things can happen between those scans, and also keeping in touch with your physicians and reporting some early symptoms. I think those are the things people can do.